We're going to talk about the 7 signs that your body is begging you for more vitamin D, as well as why daily dosing of vitamin D is crucial. Number 1, if you have high blood pressure, one of the biggest causes of high blood pressure is low vitamin D. Number 2, lowered mood, as in depression. Could be anxiety as well. Number 3, inflammation. Whether it's from autoimmune or arthritis or anything, if you have inflammation, you probably need more vitamin D. Number 4, your immune system is weak and you are getting sick too frequently. Number 5, if your sleep cycle is off, you wake up and you're not refreshed, or you have sleep apnea, vitamin D will help you get into that delta wave deep sleep so you wake up feeling refreshed. Number 6, almost every type of skin problem is related to a vitamin D deficiency. And 7, lower back pain, as well as muscle pain. If your muscles are tight, sore, and painful, take more vitamin D. It will get rid of that. Now let me just share some wild information with you. When they test you and they're looking at this inactive version, they're actually looking at mainly 2 types of vitamin D. They're looking at the bound vitamin D or the unbound, the free vitamin D. Over 99% of all of this inactive vitamin D they test in your blood is this type right here, bounded. And then you have a tiny bit that's free. The half-life for this bound vitamin D is like 2 to 3 weeks. And the half-life for the free is 24 hours. All right, so what does that all mean? It means that when they test you and you see a certain amount, they're not differentiating between the bound vitamin D or the free vitamin D. You can assume that you have enough vitamin D to support your skin, your muscles, your organs, your immune system. But unless you're taking vitamin D or getting sun every 24 hours, there's a likelihood that you're probably going to be somewhat deficient, especially with all the other barriers on top of this vitamin D situation, including obesity, insulin resistance, diabetes, being inside and not getting exposure, not getting enough vitamin D from the food. The more we age, the less we can convert vitamin D on our skin. And the recommendations for vitamin D are a joke. You need higher amounts. So this is why I recommend daily vitamin D. If your doctor says, oh my gosh, that's a toxic effect, just ask them, how much vitamin D can I get from being out in the sun for about a half hour to 40 minutes? Because the answer is 20,000 IUs. So 10,000 is not an abnormal amount. Now, the last and very important part I want to mention about vitamin D, in order for vitamin D to go through those different biochemical reactions, it needs help from certain nutrients like magnesium, like zinc, like vitamin K2, like boron. And that way you can maximize your ability to have vitamin D work without any type of deficiencies. And if you want more information on that and also how to prevent any type of toxicity, you should watch this video right here. Let's talk about how to get the benefits from vitamin D without that toxicity. Now, the danger of vitamin D really stems from calcium. Hypercalcemia, too much calcium in the blood. See, vitamin D helps absorb calcium by 20 times in the small intestine. So we're going to get a spike of calcium in the blood. And so hypercalcemia is really the big side effect of having too much vitamin D. And that could potentially lead to kidney stones, constipation, frequent urination, dementia, depression, an ulcer, abdominal pain. And just FYI, if the person stops taking vitamin D, it's reversible. Okay, so that's one point. Second point, it's very rare to have someone with vitamin D toxicity. And this is stated by the Institutes of Medicine as well as the Endocrinology Society. Now, when you measure vitamin D in the blood, if it's greater than 150, that would indicate toxicity, especially if it's taken with some type of calcium in the form of, could be some dairy or milk. All right, a couple things you want to know. Vitamin D doesn't work by itself. It needs other things. It works with vitamin K2. So I always recommend taking vitamin K2 with vitamin D because vitamin K2 keeps the calcium out of the soft tissues, like keeping calcium out of the arteries, keeping calcium out of the joints. So with vitamin K2, you want to take 100 micrograms, not milligrams, for every 10,000 IUs of vitamin D. Okay, that's the ratios. All right, number 2, bile salts. Bile salts are very, very important in helping absorb vitamin D. So if a person doesn't have a gallbladder or they're deficient in bile salts, they could have a problem getting enough vitamin D. And that can show up not necessarily in the blood, but it can show up in the conversion of the active form of vitamin D, which I'm going to get into in a second. Number 3, if you're drinking at least 2.5 liters of fluid a day, that should be enough to keep the calcium from forming kidney stones. Just that alone. All right, number 4, magnesium. Very, very important in the metabolism of vitamin D. In fact, magnesium and vitamin D work together. And then number 5 is limit the amount of dairy that you consume when you're taking a lot of vitamin D if you're concerned about developing hypercalcemia. So if you're not consuming any dairy and you're drinking enough water, you're not going to get hypercalcemia because there's not enough calcium in the diet to give you that problem. There's several studies out there that state that you would have to consume hundreds of thousands of international units of vitamin D for months for you to develop hypercalcemia. Now in the 40s, they used 200,000 to 300,000 international units of vitamin D3 to treat TB and rheumatoid arthritis. And yes, there were some side effects, but they dealt with them. So this whole idea of taking, 10,000, it seems like such a lot, or 20,000, it's actually not as much as you think, because if you convert the international units to milligrams, you'll be shocked to see how low they are. Now, I've talked about toxicity, but let's mention about deficiency and insufficiency, okay? A deficiency of vitamin D is extremely common, and that would be a measurement of less than 20 NGs per milliliter in the blood. And insufficiency is less than 30 NGs per milliliters in the blood. And so a normal amount of vitamin D in the blood should range between 30 and 50 NGs per ml. And what's interesting is 65% of the population has a vitamin D deficiency, and 95% of the population has a vitamin D insufficiency. Now, one last point before we go. When they test your vitamin D levels, they're not testing the active form of vitamin D. They always, well, not always, most of the time they test the pre-vitamin D, which is the inactive form. In order for vitamin D to be converted to the active form, you need the liver and the kidney to work correctly. So just realize that when they show high levels of vitamin D, that is the pre-vitamin D, not the active form. This is why it's good also to measure the active form of vitamin D occasionally. All right, thanks for watching.